Hello, my name's Simon Merritt. I'm Chief of Medicine at East Sussex Healthcare Trust, and I work with two Deputy Chiefs of Medicine. Medicine is a large clinical unit with a budget close to £60 million. We encompass a number of inpatient and outpatient areas and a number of specialties, including palliative care, respiratory medicine, gastroenterology, neurology, rheumatology, dermatology, and a number of others.
We've got a very exciting programme. We have 7 rotations. We go through haematology, neurology, we have stints in cardiology, acute assessment unit, and then even the care of the elderly part of the rotation is split into frailty, complex frailty. There's opportunities to do secondments in areas where if you have an interest, we have a careers champion, and it's a very, very friendly, busy district general hospital. There's 500 beds. You get exposure to all sorts of pathology, and also you have enough time to develop and gain the skills to become a very good doctor.
When you do a placement, it just tends to be a mixed match of all sorts of patients. Even though you might be on a respiratory ward, you'll have a huge mix of things. So for all medical wards, you'll sort of start your day about 8:30 or so, and which is nice because it's not as early as surgery or some other placements, and then you kind of just try and make a plan for the day. So everything obviously starts with a ward round, and then you just figure out between your SHOs, registrars, consultants about how you're going to tackle that together, and you take it from there. I guess similar to being a medical student, jobs will get generated, and then you just kind of work your way through the day.
My name's Laurenda Obeng. I'm a CT1 at the Conquest hospital. A normal day would involve morning ward rounds with the consultant and other members of the team. So mainly an F1, F2, and a consultant, sometimes a registrar. So after the ward round, in the afternoons, it's managing the wards, carrying out the jobs, and on occasion clinics if you have clinic scheduled in for that day. So normal days from 9 till 5 typically. I think some wards do 8:30 till 4:30.
On-call is quite a different experience to your day-to-day life. In some way, the job does feel like 2 completely different roles. So obviously during the day, on a normal day, it's more structured, there are more people around. Whereas if you're on call, you're more sort of firefighting essentially. You're the first point of call, really, for sort of things that tend to go wrong on the wards. Be it from very small things to more major things, but the good thing is that as an FY1, if it is a major thing, you're always expected to defer upwards. Although it can be quite daunting at times, you are always supported.
So when you're on call in the day, you're mainly in AAU, the acute assessment unit, and you go to where the patient is. So if you're referred a patient who happens to be in resus or A&E, you go to resus, you go to A&E to clerk that patient in. But if you carry the crash bleep as well, so if that goes off, you go to the ward that the patient's on. And if you have patients who have high AWS scores, then the nurses could call you and you go to the wards to see the patients there.
Good afternoon, my name's Elizabeth. I work on the acute assessment unit as one of the nursing sisters. This is a very busy unit. We take referrals from the GP surgeries and from A&E next door. We have an ambulatory care clinic which has patients coming in day to day for various treatments so that they don't have to come into hospital for an overnight stay. We welcome junior doctors. In fact, we like to pride ourselves in helping our junior doctors with their doctor's education and also to help them settle into the ward.
So the weekend on-call team consists of you as the F1 on the wards from 8:30 till like 9:15. Then they have 2 SHOs in AAU, as well as a registrar who will be clerking all the new patients in. And they've started a new role called a Twilight SHO, who helps on the wards from 2 to 11 p.m.
You have a handover list of patients that have been assigned for the FY1 to see, and there'll be some that have been assigned for the SHO, some for the Reg, and then you just go off and try and review those patients, do whatever needs doing. But your main responsibility will be kind of dealing with the bleep and any sort of problems that arise during the day.
Nights here, you have 2 members of staff leading and controlling the take. So you have the registrar and you have the CT1 or the FY2. So the CT1 or FY2 will be the referring doctor essentially. So you get referrals from A&E and GP referrals. You see the patients in AAU and you work in the acute assessment unit. So you list the patients and you see them accordingly. During nights, because it's just the 2 of you, you may get calls from the ward as well. They've now got a night twilight FY2 or CT1 who works on the ward, so they start at 2 and work till 11.
In Jerry's, we have on Monday lunchtime, we have journal club. So that's when all the consultants from all the teams and all the juniors get together, and one of the juniors will present a topic, and then there's a discussion on it. And then Tuesdays, we usually have grand rounds, and Wednesday we have F1 teaching.
Once a week we have FY1 teaching for an hour, which is also bleep free, which is nice because we all tend to work on different wards, so you don't see as much of each other sometimes as you'd like to, so it's quite nice to see each other when we do that. But also we have on Thursdays now as a new thing, afternoon report teaching, which is sort of optional teaching on not sort of strict curriculum topics, but just things of interest. Presentations given from FI1 to consultants to specialist nurses. And that's kind of more fun in terms of perhaps talks about what people have done outside of medicine and just different sort of things, which are good.
We have a regular weekly PACES teaching session for those of you that are at the stage where you want to just get the PACES and get the full membership, which is obviously a very important hurdle. On top of that, we have weekly core medical training teaching, which is consultant-led, and also there's opportunity there to deliver teaching yourself so that you can get feedback on your teaching style, and that helps with developing your teaching side of your e-portfolio. And then lastly, if you do miss the core training at Conquest, which can happen, then we've got a facility where you can video conference into the Eastbourne trainees, and that's quite nice, and that's had good feedback, and so you could even have 2 training sessions a week.
There are many different ways to tap into teaching here. You've got the regional teachings, you've got the local teaching, you've got bedside teaching, which I think is done really well here. You've got some consultants that are just amazing, and they provide extra teaching outside of timetabled hours just to help with paces and the likes. Opportunities are just plenty. You can go to AAU if you need to get a chest drain done. You've got consultants in AAU who are specialists in thoracic sort of ultrasounding, and they do these things, so you can go to them and they give you one-on-one teaching.
You get the opportunity to learn a number of procedures in both cardiology and respiratory medicine. In cardiology, you get a chance to attend the angiogram suite, observe echocardiograms being done, and also observe pericardial effusions being drained. CCU is real-life management of acute myocardial infarction and arrhythmias. In the respiratory unit, you would also be there's a lot of hands-on procedures to do, like pleural aspirations, like chest drain insertions, and management of tracheostomies. And you'll be well supported. It's a structured program, and I'm sure you enjoy your time with us.
What I run is what we call the LFG, which is a local faculty group in medicine. And this is a forum where we sit down every 3 months and all the supervisors are present. But specifically the trainees are there, a trainee from each level, and they're given a form which they can fill out independently, and they can get anonymous feedback from all the colleagues and bring this to the LFG. And it's where we listen, and I chair this, and we listen to things that could have cropped up, and so that we can be proactive and troubleshoot, which is unique to this trust.
This hospital is really good with regards to support, I've got to say. All the registrars are really lovely. If you feel that you're not coping or out of your depth, you can always call the registrars. A lot of the time, although we're taking the referrals, the registrars are clerking with you. So you're clerking, the registrars are clerking. You've got the manpower behind that. And then on the wards, if you get called and it's a patient that you feel you can't manage or it's above your competencies, you can always call the registrar and they'll be there to help as well.
For medicine, they sent out a rolling rota. I think about probably 3-4 weeks before we started the placement. And so then you can see when you're doing your weekend on calls, when you're going to be on call during the weekdays as well. And obviously sometimes you might have a wedding or something coming up, and so you can just fill out an annual leave form and swap it with another F1. And that form needs to be signed by a consultant and the administrator as well.
Dr. Merritt and Dr. Deshora, they're very good at organising the rota. So sometimes when you can't, get to swap, or you've got something you need to do, you can escalate to them and they can try and find that space for you.
There's quite a nice social scene. I do know all the trainees as they come through. We get to know what they like to do, where they're heading, and then quite often they do come back, as I did, to be a consultant.
I really enjoyed my cardiology rotation. That was amazing. Cardiology here is brilliant. Respiratory was really good as well. Lots of exposure, great consultants, great education, teaching. It's just, I love that. And elderly care I'm currently doing, it's very good, yeah.
Yeah, I've really enjoyed F1. I think it's so much better than medical school. It's a lot of fun and you don't have to study, which is really nice.
I think it's a great place to work. Once you get here, it's great. You realise that, wow, I can get all these procedures done, I can tick all this off, and my training's actually excellent.
I hope you have an enjoyable rotation, and if you have any ideas, queries, concerns, then my door is always open. Please don't hesitate to come and find me. I plan to have some regular drop-in sessions both at the Conquest Hospital and Eastbourne District General.
Hello, my name's David Walker. I'm Medical Director of East Sussex Healthcare. Welcome to the Trust. Whichever site you're working on, be it at the Conquest or in Eastbourne, I hope you have an enjoyable time with us. If you have any problems that I can help you with, then please do get in touch and I'd be very happy to sort them out for you. Welcome to you all.